Well, welcome everyone. It's always a pleasure when we get to welcome our Deputy Premier and Minister of Health here to University Health Network. As you all know, a special welcome today for the nurse practitioners in the room. It's a very important day. Earlier this month, we recognized Nurse Practitioners Week and celebrated the essential role nurse practitioners play, along with our RN and RPN colleagues in truly interdisciplinary teams here at UHN and across Ontario's hospitals and clinics. It's more than fitting today that we're here to learn about the continued changes to scope of practice for nurse practitioners and registered nurses who combine and include more than 4,300 members of Team UHN, 4,300 folks who care for patients every day. Before I welcome the Minister and Deputy Premier to the podium, I'd first like to offer a land acknowledgement. While we work closely with our Indigenous communities, we acknowledge the land we're meeting on today as the traditional territory of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee of the Wendat peoples, and home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge Toronto is covered by Treaty 13, and here at UHN, we feel it's very important that we've embedded our commitment to advancing Indigenous health and reconciliation as a foundational commitment. We're very fortunate to be guided by our Indigenous Health Program as we advance this mission into action. As I mentioned earlier, it's always a pleasure to welcome back the Minister and Deputy Premier to UHN. I also want to recognize our government's continued efforts to improve access to care and continued efforts to increase opportunities to invest in healthcare teams, particularly in our valued nursing colleagues. I know today's announcement is very much another important milestone to advance the goals. And of course, it's now my pleasure to welcome Minister and Deputy Premier Jones to the podium.
Thank you, Kevin, and good afternoon, everyone. It is indeed great to be back at Toronto General Hospital alongside your fantastic team. On behalf of Premier Ford and our entire government, I want to thank you for hosting us today and for all you do to provide exceptional care to patients and families across Ontario and indeed across Toronto as well. Under the leadership of Premier Ford, our government has been making record investments in healthcare to make it faster and easier for people to connect to the right care in the right place. We are building capacity across our healthcare system, in community pharmacies, in primary care, and of course, in our hospitals. And today, I am delighted to announce our government is continuing to build on that progress by expanding the role of nurse practitioners and registered nurses. Expanding the scope of practice for nurse practitioners and registered nurses will make it faster and more convenient for Ontarians to connect to care, and allows them to work to the full extent of their expertise and training. The changes, which have been made in consultation with the College of Nurses of Ontario and other healthcare partners, include allowing nurse practitioners to order and apply a defibrillator to someone in cardiac arrest, and to order and apply a cardiac pacemaker. Nurse practitioners will also be able to perform electrocoagulation. See, I practiced that, and there I went. Electrocoagulation to treat skin conditions and lesions, such as skin tags, helping people to get them removed sooner. This scope expansion will also improve the end-of-life experience after the death of a loved one. By allowing nurse practitioners to certify death in more circumstances, and allowing registered nurses to certify a death when the death is expected, ensuring certification is completed faster while preserving dignity for families. These changes will improve access to care for Ontarians across Ontario, especially for Indigenous communities and those living in rural, northern, and remote communities. Expanding the role of our highly skilled nurse practitioners and registered nurses is yet another step our government is taking to provide more people with the right care in the right place. Today's announcement builds on our government's recent $500 million investment to bring more nurses into the healthcare system by educating new nurses, increasing opportunities for current nurses to access specialized training to upskill while on the job, and reducing barriers for internationally educated nurses, allowing them to register to work in Ontario faster and start caring for Ontarians sooner. Since 2018, Ontario has seen a record-breaking number of new healthcare professionals join the healthcare workforce, adding nearly 100,000 new nurses, with a record of more than 18,000 new nurses added last year alone. Another 30,000 nurses are currently studying at Ontario colleges and universities. And we have added 6,500 new spaces in Ontario nursing programs over the last 3 years. This is on top of the 121 new nurse practitioner training positions added last year. Our government is also investing $743 million over 3 years to continue to address immediate healthcare staffing needs, as well as to grow the workforce for decades to come. Ontario is proud to be home to world-class healthcare professionals, and expanding the role of nurse practitioners and registered nurses is just one other way we are providing more connected and convenient care to better meet the needs of Ontario families. Thank you again to the entire team here at the Toronto General for the incredible care and support you provide patients and families in our province. I'd now like to invite Pam Hudley to share a few words. Stay well.
Thank you so much. As a registered nurse and UHN's Vice President of Health Disciplines and Chief Nurse Executive, I can say this is truly an exciting day for our profession. Today's announcement recognizes that nurses are leaders, innovators, and offer professional expertise that is crucial to the future of care delivery. At UHN, patients are central to everything we do. We also strive to be a place where healthcare professionals can find a dynamic, meaningful place where they can grow, develop their profession, their professional career, and never stop learning. Today's announcement is a welcome change that will be pivotal to optimizing patient care and enhancing the patient experience. It will be an essential element in maintaining a strong, adaptable healthcare system and fostering growth within the profession. At UHN, we have about 42,000 registered nurses at all of our sites who provide some of the most integral care to patients, some of the most vulnerable patients we treat in Ontario. There are also about 160 nurse practitioners across our 5 hospitals providing a wide range of services, including assessing and triaging patients, ordering and interpreting diagnostic tests, diagnosing illness, developing treatment plans, and referring patients as required. Nurse practitioners often work in collaboration with physicians and other healthcare professionals to deliver comprehensive care, and they play a crucial role in health promotion and prevention of disease. Investing in the scholarship, professional development, and expanded role of our nurses and nurse practitioners is key to a solution in advancing UHN's mission of a healthier world. It is through initiatives like this that we can enable nurses to push boundaries and champion change that benefits the patients and that we have the privilege to serve. It will also help us develop the next generation of nursing leaders and healthcare providers. Now it is my pleasure to introduce Barbara Bailey, a nurse practitioner with the Toronto Adult Congenital Heart Disease Program at UHN's Peter Munk Cardiac Centre. And also we're proud to say she's a president of the Nurse Practitioners Association of Ontario.
Thank you so much, Pam, for your kind introduction, and to UHN leadership, Kevin, for your ongoing support of nurse practitioners here at UHN. A special thank you to our Minister Jones and her entire team, whose commitment to expanding the role of nurse practitioners and registered nurses in Ontario make it faster and more convenient for people to access care here at UHN and across Ontario. Nurse practitioners are highly educated and have on average 10 years of nursing experience before becoming a nurse practitioner. With over 5,000 nurse practitioners in Ontario and more than 160 right here at UHN, nurse practitioners play a pivotal role within the healthcare system, specifically here at UHN. They are uniquely positioned within interprofessional teams across specialty areas within the organization. For example, as Pam mentioned, I am the nurse practitioner for the Toronto Adult Congenital Heart Disease Program here at the Peter Munk Cardiac Centre, which is one of the largest and oldest acute congenital heart disease programs in the world. I have developed advanced knowledge in adult congenital heart disease, specifically in postoperative management. There are 10,000 persons living with adult congenital heart disease, followed here at the Peter Munk Cardiac Centre, and this is not unique to the NP role across specialty areas within our organizations. These nurse practitioners work in collaborative teams, as mentioned by Pam, with physicians, nurses, and other essential healthcare providers. We cannot do this work alone. This announcement today will enable nurses and nurse practitioners to practice an expanded scope, removing existing barriers to practice, ultimately improving access to care for patients here at UHN and across Ontario. Importantly, the government recognizes the value and contributions of nurse practitioners and is committed to working together, coming up with innovative solutions to ensure people in Ontario and across the country have access to timely health care. Thank you again to Minister Jones, her team, UHN leadership, and to all of you, nurse practitioners, nurses, whose contributions to patient care is absolutely invaluable.
Well, Barbara, thank you very much, and congratulations on a remarkable career here at UHN and in spawning the development of so many other nurse practitioners. Really very grateful. So before I turn this over back to Minister and Deputy Premier Jones, I think we should give all the nurses a round of applause for an amazing day and amazing contribution. And the Minister will now take some questions from our media colleagues.
All right, we'll now open the floor to questions from the media. If media present can kindly line up behind me at the microphone. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question.
Where is the cost on this? Is it going to save taxpayers money or the healthcare system money?
It's really about access, Jamie. So what we have is incredibly highly competent nurses, RNs, nurse practitioners, who in many cases have done a lot of the work during their training. And now able to expand scope of practice ensures that those skill sets can be used. And again, as was referenced, it's really that multidisciplinary team approach where everyone ends up being able to better serve the patients that are directly in front of them. We have done a lot of work with the College of Nurses of Ontario, with the Nurse Practitioners Association of Ontario, hearing their feedback on what individuals are already trained for, what they can easily be trained for, and ultimately expand that scope of practice. So this is not a cost-saving measure. This is truly an access and improving access for Ontario residents.
When you look at this hospital here, one of the best in the world, and only in competition with several hospitals around here, I understand how it's going to work in this hospital, but how's it going to work in the hospital in Lindsay, or how's it going to work in the hospital in Collingwood?
Yeah, it's a great question. So in my remarks, I specifically highlighted how in Northern Ontario and remote and rural, the use and the participation rate of nurse practitioners in communities actually increases. So what we see is, as an example, allowing RNs, nurse practitioners, to issue that death certificate really takes some pressure off some of the other parts of the system. And it's really about the comfort for the patient's family. So I think that you will see many of these scope of practice changes actually having a bigger impact in some of those small communities like a Lindsay, like Northern Ontario, and of course Indigenous communities as well. I love that these questions are all related to today's announcement.
All right, and on that note, Minister, that concludes our media questions for today.
Thank you.